Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Now we're looking at the gene defects, and this is which is associated with the congenital heart diseases. So first is the CHAR syndrome. The CHAR syndrome is the cardiac defect or the PDA, that is the patent ductus arteriosus. Then is the Alagille syndrome. Alagille syndrome. This is nothing but the pulmonary artery stenosis, and this also involves the tetralogy of Fallot. Then comes the CHAR syndrome. The CHAR syndrome, it involves the ASD, the radial septal defect, the ventral septal defect, as well as the patent ductus arteriosus and the hyperplastic right side of the heart. Next is the Noonan syndrome. Noonan syndrome is a pulmonary valve stenosis. There is VSD, ventral septal defect, hypertrophic cardiomyopathy, the DGeorge. There's a DGeorge syndrome. This involves the ASD, VSD and outflow tract obstruction, and the Holt-Oram syndrome. Holt-Oram syndrome is again the ASD, VSD or the conduction defect. To learn and grow daily like this, please do subscribe.